Bed making. Definition. Bed making is a process of making neat and clean bed for the hospitalized client. Bed making is an art of preparing the appropriate bed based on the condition of the patient, which adopts scientific principles of nursing. Purposes of bed making: to provide rest and sleep, to provide physical and psychological comfort and security to the patient, to give the unit a neat and clean appearance, to establish an effective nurse-patient's relationship, to provide active and passive exercise to the patient, to promote freshness and cleanliness, to observe, identify, and prevent patient complications, to accommodate the patient's needs, to reduce patient's exertion by bed making, to eliminate irritants to the skin from the patient's body, to dispose of soiled and dirty linen properly. Another purpose of bed making is to save time, effort, and material properly. Principles involved in bed making: principle of infection control, principle of work organization, principle of safety, principle of privacy, principle of body mechanics, principle of time management, principle of communication, principle of infection control. Wash hands before and after making any bed. Wash hands thoroughly after handling a patient's linen. Hold soiled linen away from uniform. Linens and equipment that have been soiled harbor microorganisms that can be transmitted to others directly or by nurses' uniform or hands. Always have receptacle at hand for putting in soiled linen. Hamper. Linen for one patient is never, even momentarily, placed on another patient's bed. Do not shake linen in the air because shaking can spread microorganisms. Principle of work organization. The ward should be prepared for bed making. No feeding or any other treatment should be going on during bed making. All materials including the linen should be gathered before starting to strip or make a bed. 2 nurses are required to make the bed and they should work in harmony, one on either side of the bed. If one nurse must make the bed, the linen must be tucked in and finished on one side before moving to the other side. Principle of safety. Keep patient in position required for his/her treatment throughout the procedure. Support patient when necessary. One nurse may do this as the other makes. One side of the bed. Side rails can be used if bed making is being carried out by only one nurse. Patient's face must not be covered by the sheet. Bed linen must not be tucked in tightly over the patient's feet and shoulders. Be sure that the patient is comfortable after making the bed. Principle of privacy. Patient must never be exposed. Make use of screen when making an occupied bed. Principle of body mechanics. Elevate adjustable bed to waist level and lower side rails to prevent stretching. Bend knee to lower center of gravity towards patient to be moved. Allow patient to assist when turning moving as the condition of the patient permits. Use mechanical aids or additional personnel to move or turn bariatric, heavy, patients. Stand close to patient and keep your back straight as much as possible. Bend knees and not back. Principle of time management. When stripping and making a bed, conserve time and energy by stripping and making up one side as much as possible before working on the other side. If 2 nurses are making a bed, they should work in harmony, one on either side of the bed. Principle of communication. Any conversation during bed making should include the patient and should not be on personal matters between the nurses. This brings about more social interaction between the nurses and the patient. Practice guidelines. All equipment should be collected before starting. Bed should be made in such a way that patient can be put in it without difficulty. The bed should be free from crumbs and creases and should give a maximum comfort to the patient. Pillows and other bed accessories should be well arranged to give support where necessary. The patient's face should never be covered by sheets or blankets. Extra assistance should be available and, if necessary, one should be called upon to help lift the patient. When pillows are being shaken, the nurse should turn away from the patient. The open side of a pillowcase should be away from the main door of the ward. Always have a dirty linen bin at hand in which to put dirty linen. Dirty linen should not be carried across the ward to prevent cross-infection. Allow room for the patient feet for free movement or turning when placing the top sheet over the patient. Any conversation during bed making should not be on personal matters between the nurses. Always wash hands before and after bed making. Precautions to be taken during bed making. The uniform of the nurse should not touch the bed while making a bed. Soiled linen should not be thrown on floor. First lift the mattress while loosening the bed linen or removing the sheets. The sheets should not be pulled forcefully. The bed linen should be folded from top to bottom or side to side. This applies to fold the mattress also while making one unoccupied bed. As self-precaution while tucking bedding under mattress, the palm of the hand should face downwards to prevent injury of nails. The open end of the pillow should not face to the entrance of ward. The beds should be in one line for better look. Types of bed. Stripping the bed. This is a procedure to remove bed linen from a bed, which has been previously used. This is required either to air the bed or put the bed in sun or making it ready for future. Procedure. When a chair or a stool has been provided with the bed, the chair or stool is placed at the foot end of the bed. Place the pillow over the seat of the chair or on stool. The bed sheet should be loosened from right. Fold bed sheet twice, bring top hem to bottom hem, pick up at the center. The blanket should be folded in similar way. Soiled sheets should be removed and should not be thrown on floor. Fold the draw sheet in two and place it over the chair. The mackintosh should not be folded but rolled up. The mattress should be turned from top to bottom or from side to side. Simple routine bed. Unoccupied bed. It is a type of hospital bed that does not have a patient in it. It has two types. One closed bed. It is an empty bed in which the top covers are so arranged that all linen beneath the spread is fully protected from dust and dirt. Purposes of closed bed. To keep bed always ready to receive patient in emergency. Prevent wastage of time to initiate treatment. It gives neat and clean appearance to the unit. Equipments. 2 large sheets. Draw sheet. Blankets. Bedspread. Pillowcases. Rubber mackintosh. Linen hamper. Bedside table stool. Disposable gloves. Procedure. Wash hands and wear disposable gloves. Assemble and arrange equipment on bedside table. Fold and keep reversible linens such as blanket or bedspread on bedside table. Bundle all soiled linen in bottom sheet and directly place into the laundry bag. Place the bottom sheet with its center fold in the center of bed and towards the top to have sufficient sheet to tuck under the head of the mattress. Unfold the bottom sheet, spread it over the mattress and tuck in severely with mitered corner. Spread the mackintosh at the center of the bed and tuck it along the side. Place the draw sheets over the mackintosh and tuck it along the side. Move the opposite side and tuck the sheets. Place the blanket over the top sheet about 6 inches below the top of the sheet. If the bedspread is used, place it over the blanket. Tuck the top sheet, blanket and bedspread under the foot of the bed on the side close to you and miter the corners. Fold the upper 6 inches of the top sheet down over the spread and make a cuff. Move to other side and follow the same procedure for screening top sheets. Put the pillowcase and place the pillow at the head end. Fanfold or bifold top linens. Rearrange furniture and place personal items within easy reach. Adjust the bed to a comfortable height. Dispose of soiled linen and wash hands. To open bed. The term open bed is used to designate the hospital bed when it is about to be occupied by a client. Purposes of open bed. To prevent bed sores. To economize time, material and effort. To give to the unit or ward a neat appearance. To provide comfort and security. To provide rest and sleep. To establish an effective nurse-patient relationship. Articles. 1 bottom sheet. 2 36-inch mackintosh. 3 36-inch draw sheet. 4 top sheet, 5 blanket, 6 bedspread, 7 pillowcase, 8 duster. 2. Procedure. Wash hands and collect required linen. Arrange linen on chair in manner in which it is going to be used. Explain procedure to the patient and relatives. Screen patient, if necessary, and loosen top bedding. Lift patient's head and remove extra pillow. Loosen bottom bedding and remove top sheet by pulling it down from under cover. Brush off the Macintosh and roll it back loosely over patient. Roll bottom sheet as far under patient's back as possible. Place the clean sheet on the mattress with lengthwise fold at center of the bed. Adjust sheet and tuck in at the top, making a square corner. Then tuck in at the side. Bring back Macintosh lying over the patient. Place clean draw sheet at the center of the bed. Pull and tighten bottom sheet and tuck in at top, making a square corner. Pull and tighten Macintosh and draw sheet and tuck in well. Turn the top of the counter pan and top sheet back over the blanket. Return to the other side. Fold and tuck in top bedding as on the first side. Change the pillowcase and put it under patient's head and shoulders. Discard soiled linen in dirty box. Make the patient comfortable. Wash hands. Occupied bed. An occupied bed is making the bed where the patient physically available in the bed or the bed is being retained for patient. Purpose of occupied bed. To provide active and passive exercises to the client. To promote cleanliness. To establish effective nurse-client relationship. To prevent bed sores. To observe the client's, e.g. bed sore, oral hygiene, client's ability for self-care, etc. To economize time, material and effort. To provide the clients with safe and comfortable bed to take rest and sleep. Articles. 1 top sheet, 2 blanket, 3 pillowcase, 4 bottom sheet, 5 36-inch Macintosh, 6 36-inch draw sheet, 7 counter pane, 8 duster. 2. Procedure. Assemble the equipment and arrange the linen within the easy reach. Turn the patient to bring him at the edge of the bed. Loosen the bedding on all sides and remove the spread and the blanket, leaving the top sheet over the client. Fanfold the draw sheet to the client and push it as close to the client as possible. Dust the mattress with a dry duster. Then, by raising the mattress, clean the cot with a damp duster. Place the clean bottom sheet over the mattress, making sure that the middle fold is in the middle of the bed. Bringing the Macintosh back into the place and tuck it tightly under the mattress. Turn the client back over the folded linen and then towards you. Go to the opposite side of the bed. Remove the soiled linen and put them in the laundry bag. Turn the client back to the middle of the bed. Place a clean top sheet over the client and remove the soiled top sheet. Replace the blanket and spread over the top sheet and make the bed as in an open bed. Tuck the foot end, giving enough freedom for movement. Place a footboard or cradle at the foot of the bed. Put the clean pillowcases and place the pillows in position and leave the client comfortable. Special types of bed. A bed which is prepared to meet special needs of the client. Operation bed. Post-operative bed. It is one which is prepared for a client who is recovering from the effects of anesthesia following a surgical operation. Purposes of operation bed. To receive the patient in a warm and comfortable bed. To give him necessary position, which is suitable for the operation. To protect the patient from being chilled. To be prepared to meet any emergency. To protect the mattress and bedding from bleeding, vomiting, drainage or discharges. Articles. 1 gauze pieces, narrow Macintosh and narrow sheet. 2 artery forceps. 3 mouth gag, airway. 4 TPR tray BP apparatus. 5 bed blocks, 2. 6 hot water bags with cover. 7 I.V stand. 8 kidney tray and paper bag. 9 suction apparatus and oxygen cylinder. Procedure. Prepare the foundation of the bed as simple bed. Put narrow mackintosh and narrow sheet at the head end to protect the bed from soiling the linen by vomitus. The foot end of the top linen are left untucked. The upper bedding is fan folded to one side, opposite the stretcher. Post-anesthetic tray, bed blocks, IV stand etc. are kept ready at hand. The pillow is used to protect the patient from injury by hitting against the bars at the head end of the bed. Hot water bags are used to keep the bed warm and they are removed before receiving the patient in the bed. Cardiac bed. Cardiac bed prepared for patients with heart diseases. Purpose: to relieve dyspnea caused by cardiac diseases. To provide comfort with least strain. To prevent complications. Articles: 1 bed sheet, 2 36-inch mackintosh, 3 36-inch draw sheet, 4 top sheet, 5 blanket, 6 bedspread, 7 pillowcase, 8 duster, 2, 9 cardiac table, 10 extra pillows, 11 backrest, 12 footrest, air cushion. Procedure: prepare the bed as open bed, with footrest at foot of the bed. Place backrest at patient's back, and arrange pillows in comfortable position. Keep the patient in bed and cover properly. Adjust the air cushion in place. Place the knee pillow under the knees to prevent slipping of the patient. Place cardiac table in front of the patient with the pillow on it, so that the patient may lean forward to rest his head and arms on it. Make the patient comfortable. Blanket bed. Renal bed. Blanket bed is prepared for a patient with renal diseases or rheumatism. Purposes: 1. To promote elimination through the skin. 2. To provide absorption of patient's perspiration. 3. To carry the weight of the bed clothes of the painful joints. 4. To provide extra warmth to the body. Articles: 1 bed sheet, 2 draw sheet, 3 top sheet, 4 blanket, 5 bedspread, 6 pillowcase, 7 duster, 8 extra pillow, 9 2 old wooden blankets, 10 narrow mackintosh and sheet, 11 sandbag, 12 bed cradle. Procedure: the bed is prepared as usual, open bed. Cover the bed with blanket instead the bottom sheet. Place narrow mackintosh and narrow sheet in the usual manner. Place second bath blanket over the patient. Cradle is used to take off the weight of the top linen of the painful joints. Sandbags are used to immobilize the painful joints. Amputation bed. Amputation bed is prepared for a patient with amputation of the leg to take off the weight of the bed clothes off site of the operation. Purposes: to keep the stump in good position. To be able to watch the stump for hemorrhage and apply tourniquet instantly if necessary. To allow the nurse to do repeated procedures such as bladder irrigation, without exposing the patient. To allow the nurse to make frequent observations, i.e. after amputation of the leg without disturbing the patient. Articles: 1 set of top extra bedding, 2 blankets and counter pane, 3 bed cradle, 4 tourniquet, 5 pillow and plastic cover, 6 sandbags and draw sheet. Procedure: prepare the bed as simple open bed. Make bottom half of the bed. Fold sheet crosswise at the center of the bed at bottom, tuck in and make corners. Make upper half of the bed. The other set of the top linen starts from the stump, but overlapping the first one, and the excess is tucked under the mattress at the foot. When the patient is brought back from the operation theatre, fan fold the 2 sets of linen one side of the bed and receive the patient on the bed. Bed cradle is used to take off the weight of the top linen. Cover the patient and keep him warm and comfortable. Amputation bed is usually used for amputation of the leg. Operation bed is used for an amputation of the hand. The 2 sections of the top linen should overlap each other at least by 8 to 10 inches. So that it can easily lifted to observe the stump and also to prevent unnecessary exposure of the patient. Fracture bed. Fracture bed is prepared for patient with fracture of the trunk and extremities. A hard firm board is used to give support. Purposes: To give firm, even support to the fracture limbs and back. To maintain position. To immobilize the fractured so that the pain is less. To make the patient comfortable. Articles: 1 bed sheet, 2 draw sheet, 3 top sheet, 4 blanket, 5 bed spread, 6 pillowcase, 7 duster, 8 fracture board, 9 sandbags with cover, 10 bed cradle, 11 extra pillows. Procedure: place the fracture board directly over the bed springs. Place a thin firm mattress or pad over the fracture board. The bed is prepared as simple open bed.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.